Now, 2 years into the COVID-19 pandemic, and much of the world has embraced the shift to a new normal. But many lower-income and vulnerable countries are still struggling to find a path forward. Or they face low vaccination rates, poor testing capacities, and fragile health systems. For a closer look, we're joined by Dr. Abhishek Rimal. He's Asia-Pacific Emergency Health Coordinator with the International Federation of Red Cross and Red Crescent Societies. Dr. Abhishek, your organization has warned of this for a long time. In fact, late last year, that report from then said the world is on course to wildly unequal recovery depending on efficacy and equity of vaccination programs. We have seen this inequity in 2020, 2021, 10.85 billion doses of vaccines delivered so far as of today, and more boosters have been administered in high-income countries than we have seen in all doses in low-income countries. So this warning that you have delivered again and again, is anyone heeding it?
So thank you for having me in the call. Like, the unequal access to the vaccine is hurting us the most. Many of the world population and communities are lacking the COVID-19 vaccine. We have seen lately a rise in COVID-19 vaccine in the low-income countries and low-middle-income countries, but it is far from efficient enough to bring down this pandemic. If we want to see this pandemic to come to an end, we need to scale up vaccination right now. It is a moral implication for all of us to ensure that the COVID-19 vaccine reaches the last mile. And the Red Cross, Red Crescent National Societies, together with the IFRC, stay committed on the ground to deliver this COVID-19 vaccine once it reaches the airport tarmac to the arms of the beneficiaries in the vulnerable communities as such. I would like to re-emphasize that many communities, people, and countries cannot afford to live with this virus. Rather, they will have serious consequences on their health, and some of the people will die because of this deadly virus if we will not counter the inequities on COVID-19 vaccination.
And Dr. Rimal, some of those very vulnerable communities are in the Pacific Island nations. Some of them are only just seeing their first outbreaks, like Tonga as an example. What is the real risk of their healthcare systems being overwhelmed in the immediate and perhaps long term as well?
Yeah, like several Pacific countries have a weak healthcare system even before the pandemic have started. The Pacific has been very lucky that they have escaped a couple of waves of COVID-19 vaccine. But now several countries in Pacific, including Tonga, Kiribati, Solomon Islands, are seeing the impact of COVID-19 in their countries. The vaccination in some of the Pacific countries are scaling up nowadays. So we are yet not seeing a major impact on their health system, but if it does not scale up rapidly in due course of time, we will see a major impact on their healthcare system and lives and livelihood of the people out there.
Dr. Abhishek, you have warned of far more than just health impacts, but, and I quote you, secondary consequences on socioeconomic lifestyles, mental health as well.
Look, like, we are in this pandemic for more than 2 years, and this pandemic fatigue is slowly creeping into the people. People are sick and tired of this COVID-19 and wants to go back to the normal life. It is severely impacting the mental health of the people across the board. We have also seen a huge impact of COVID-19 on the socioeconomic front. The most vulnerable, the poor people, have been severely impacted. The daily care workers, the workers who are dependent on the informal sectors, have been severely impacted. There was a report from Asian Development Bank which clearly indicates 80 million people have been pushed down to extreme poverty as a direct result of COVID-19 pandemic. On top of that, we have seen hundreds and thousands of people have died because of COVID-19. And in Asia Pacific alone, more than 980,000 people have died, and several of them were the breadwinners in the family. We have seen huge socioeconomic burden of this COVID-19 on the people and has also impacted their mental health.
Our thanks to that Dr. Abhishek Rimal, Regional Emergency Health Coordinator, Asia Pacific at the International Federation of Red Cross and Red Crescent Societies.